Thank you. Thank you for having me here today. Look, just before talking about the actual assurance score, I thought I'd just do a quick background as to why it was created in the first place. The previous National BJD Strategic Plan, which was originally meant to run through to 2020, was due to be reviewed, but a review was brought forward into 2015 due to a number of incidents of BJD being detected in Queensland and a huge number of traces up there, leading to many properties being placed in quarantine in multiple states. Little disease was detected, but serious business disruption occurred on those properties. There was also different strains of Johne's disease in cattle showing up with different treatment of those particular cases depending on the strain. And I guess finally the other issue that was occurring was decreasing numbers in the Johne's disease market assurance program for cattle, or cattle map. So the review was held over the course of 2015 with multiple rounds of consultation, and the final framework document was produced and endorsed by the BJD Steering Committee in March 2016. The objectives of the new management strategy for JD and cattle are to manage and reduce the impact of clinical Johne's disease and provide tools to allow individual producers to manage the spread of Mycobacterium paratuberculosis infection in accordance with their business requirements. So this new approach started on the 1st of July 2016 in most states. Western Australia and Northern Territory remained in consultation between the government and the state farming organisation through until February and March this year. The new JD and cattle framework, the elements of that is that JD is to be included in a broader biosecurity approach. That there'll be the removal of the zones that were previously there and now be brought back to the property level for management, and states to remove regulation except the one remaining element that was kept was notification. So if a case is found, then that needs to be notified to the government. All strains in cattle are considered JD now, rather than it just being cattle strain as it was under the previous strategic plan, and that a number of tools would be provided to help producers with JD and other production diseases. There were already some existing biosecurity tools in place, so the National Farm Biosecurity Reference Manual for grazing livestock production has been around for quite a number of years and is looked at as sort of minimum standards for the industry, not just for beef cattle but for the sheep, goats, alpacas industries as well. The National Cattle Health Statement was revised to become the National Cattle Health Declaration, and that's available on the Farm Biosecurity website, along with a number of other tools, so information, manuals, apps, the ability to order the Farm Biosecurity gate signs and videos are all available on the website there. So the framework called on a risk profiling tool to be developed that took into account the biosecurity practices on a property and the testing history. This would then allow an estimate of the herd's risk. The dairy score was already in place. That's been around for quite a number of years. The dairy score is managed through Dairy Australia. They revised that just about 18 months ago. The tool that was to be developed needed to be biosecurity based, obviously in keeping with the objective of the new approach, be relatively simple, have a pathway to progress even with a positive test result on a property or in a herd, and include non-testing levels. So the Johne's Beef Assurance Score, or J-BAS, is an acronym used quite often. It's a fairly simple table, basically numbers 0 to 8, the numbers do equate roughly with the dairy score. So when this was being developed, the cattle industries were keen that the two scores roughly align. So the dairy score, revised dairy score, it runs from 0 to 8 as well. Obviously, there are some numbers missing from the beef score, and that's because the dairy score has quite a few levels where herds may have infection and are working their way back up through those levels with various activities. The core basis of the whole score is to have a biosecurity plan on the property, so implementing a plan, which is the general plan, with some additional Johne's disease elements added in. The highest scores, so 7 and 8, are sort of assurance type levels where some testing is required, and the testing in the table here is what you would do to reach those levels or maintain the level with a check test. And a veterinary advisor needs to oversee the plan obviously as well as the testing. The lower levels obviously have different features there. So they're first removing clinical cases if you've had Johne's disease on the property, and then time without those cases, and having a biosecurity plan in place allows herds to progress up the table. Obviously in the middle there is a level 6, managed disease risk, which is having removed cases of Johne's disease in the past and having maintained a biosecurity plan in place for a number of years. At the bottom, obviously, is suspect and infected herds who are doing nothing about the issue. So I guess the one complicating factor of J-BAS was the transition. So the transition period from July 2016 to June 2017 was meant to allow for the previous state-level biosecurity or regulatory coverage to count towards the biosecurity requirements of J-BAS. So producers who were previously part of the national zones and beef only in the management area initially had that 12 months to be able to transition into J-BAS if they wish to use it. Equivalence to the dairy score tool meant that most herds would transition across at J-BAS 7 rather than at a lower level of, say, 6. In May and June this year, Cattle Council made some amendments to, I guess, the policy of J-BAS, so that the default would be a J-BAS 6 from June 30 instead of the 0 that had originally been intended. And that also producers wanting to return to their transition score are able to do so over the next 12 months by implementing the things that needed to be done for that level. So for a 7, it would be a veterinary oversighted plan and a check test. Of course, if that's not what they want to do, then they can remain at a 6. Where is J-BAS recorded? How, the nuts and bolts of it. The plan, if you're at a 6, is something that's just kept on the property. There's no need to lodge that with anyone. This simple tool is not like Cattle Map, where a state coordinator was oversighting the process. It's more about what happens on the property, unless you're at a 7 or 8, where a vet would be involved. So the score, it can be recorded on the cattle health declaration up there in the highlighted yellow section. There is where it is. It's an optional inclusion in amongst a number of other Johne's disease questions which fit within a number of other disease questions. I guess the intro suggested that the J-BAS is the most important tool. I'd actually suggest that the cattle health declaration is the most important tool. The score is just a guide. It's really just a starter. If people are really interested in JD, then they should be asking other questions of the seller, that should say, rather than just relying on a score. So some of those further questions are on the National Cattle Health Deck, and more can be asked if there is a need. the complementary tools to the score. So I've mentioned the reference manual already, so that's been in place for quite a long time, with quite a number of people wanting to use the Johne's Beef Assurance Score. A number of templates have been developed that match up to the reference manual, so essentially ticking off on all of the elements that are within the reference manual. There's an example down in the right corner there of the one that can be found on the Farm Biosecurity and Animal Health websites. Relatively brief document that's fairly easy to fill in and can be complemented by other documents as required. The final piece is the JD checklist, which is to provide advice about the components of a farm biosecurity plan that are specific to Johne's disease and things to think about when assessing the risk of Johne's disease when purchasing cattle. So why would anyone use J-BAS? Look, I guess I mentioned Western Australia and Northern Territory earlier in the presentation. So when they finally did decide on what they were doing, at the departments at the behest of their state farming organisations have maintained regulation for Johne's disease, and they have referenced J-BAS in the entry requirements. The Northern Territory, which initially was 7, has now a score 6 requirement. Western Australia has a much higher level of assurance required, so a level of 8 with some other entry requirements, and anyone looking to access that market should really look at the entry requirements on the health certificate for entry to the state. So other than those two markets, there's no one stipulating or requiring the J-BAS, certainly in a regulated sense. However, if a producer has an interest in preventing JD in the beef herd, they can maintain a J-BAS 6 fairly easily by just implementing the plan. Of course, if you don't have an interest in Johne's disease, and as Tony will show in a little while, it's not one of the most significant diseases out there to be considered, there's no need to use the J-BAS. However, I should point out that, and obviously there's been a fair bit of press recently, that a biosecurity plan requirement is coming for livestock production assurance from October 1st, 2017 through MLA and the Integrated Systems Company. So the same plan that could be filled out for J-BAS at the moment can be used for that LPA requirement when it comes in. For more information, there's a number of websites with information there. Obviously, the Animal Health Australia website, Farm Biosecurity, and also the Livestock Biosecurity Network. So there's an extensive question and answers page on the AHA website. Thank you. So that's it from me, and Tony's going to say a few words.
Questions after me.
Yeah, we'll first hear from Tony and then a couple of questions.
Yeah, look, I'll certainly take questions too, Chris. The first thing I'd like to point out to you is the document on the left. Both these documents have age about them. That's 2013. The spread of the disease in the beef cattle industry, those dots are where the cases in the beef industry have been. The red ones are sheep strain, the green ones are untyped, and the blue are cattle. So there is a spread of them. The numbers are not big. So, and again, where's the risk and how do you manage that risk? I think they're the questions you need to be asking. The document on the right is 2014 survey of the endemic diseases in cattle in the beef herd at their cost of treatment and their cost to production. Bovine Johne's is the little one right on there, number 17. Sorry, you're right, I'm looking at a different screen. This is the whole of beef industry, so cattle ticks the one on your left. Then you go right across, there's buffalo fly, dystocia, calf mortality, bloat, botulism, grass tetany, calf scours, vibriosis, tularemia, pink eye. It's cost to the industry, and Johne's is right down there. So what I'm trying to get to you is that you should put it in perspective as where Johne's exists in the industry and the cost to your enterprise. So the concept of, hang on a sec.
Wayne, please.
The risk you have to look at is your risk in your business. Under the new Biosecurity Act, you have to be aware of your risk, what its level is, and manage accordingly. And so the point of the sheep strain little box in there, the green box, is that in that mixed area of sheep and cattle, 50% of the diagnosed herds are sheep strain. Now, the numbers aren't big, so work out your risk and manage accordingly. So I'll leave it at that, and I'm happy to take questions.
Right. Peter. Just wait for your mic to engage.
Beg your pardon?
Yep, no, we've got you.
Right. Now, I'd have to dispute the thing you put up there, public consultation. I might live in a tent, but, you know, I haven't heard a bloody thing about this, and I went to a public meeting in Dubbo, and all we got was confused. So that's the first thing. Now, where on earth did this generic come from? I mean, quite clearly, you started off looking at Johne's disease in cattle. If you look at the biosecurity module or the biosecurity plan that you've put out everywhere, there's not a bloody squeak about any other animal except cattle. And including that, you've got a description of clinical disease in cattle, which doesn't match up with anything else. So obviously you didn't tell the poor blighter that wrote that you were suddenly going to change it to generic. So where did that come from, and whose smart idea was that? The next thing that somebody said was the score is just a guide. That's not right. I don't know where you fellas come from, but I mean, there's two places you can sell them. You can sell them over the hook. You can sell them direct to the abattoir, which of course it doesn't matter at all. You can sell them through one of the electronic systems, and maybe people have time to sit and look at it. But most people, well, a lot of people, sell in the sale yards. And in the sale yards, about 70% of cattle do not go to slaughter. So the bidders there are either the feedlots or the people who want to buy them and put them back on their farm. Now, if you put J-BAS score up there that's less than 6, they've already said it. We're not going to buy them. Or we're not going to bid enough money. We'll take them for nothing. So you've completely disrupted the orderly marketing of cattle. Now, you know, I'm not going to go too much into this because I've got to talk about after this, but I mean, the risk there, you're right, Tony, the risk is small. But you can't go and tell all the people who go and buy that, because somewhere along the line, on a sale yard, there's going to be something, either an announcement or a piece of paper that says it's J-BAS less than 6, and the buyers will just walk on. Now, that is fine if the person has had a recent case of BJD in their herd. If they've just had a recent case of OJD in the herd, I'm going to put evidence here that the risk is 1/100th of what it would be as if you had BJD in your herd. But you put them both together and you buggered up those people's method of getting rid of it. I mean, I don't know why you didn't think about this or why you didn't talk to them. So, really, you know, you could probably talk for an hour against this, but, you know, it seems to me to be an extremely ill-thought-out plan, and please tell me why you suddenly changed it to generic at the last minute, because the best I can come up with is 3 months appears to be. Like, I've got a lot of veterinary colleagues, and talking to them, I haven't got any of them talking about it closer than 3 months ago.
Dr. Carter, the first thing about anything to do with Johne's is not definitive. And right from the word go, we've had tests that have never been 100%. So I agree with you that things are changing, but the evidence that has been coming through from, and those cases were 2003 to 2013, was that it had jumped the species. And my understanding is overseas.
There's evidence of that going back 200 years. It has been in Europe for 400 years. There's plenty of evidence of the sheep strain getting into the cattle strain. This is not something that's new. Yes,
exactly. And all we're doing in this is recognising the reality. That's all there is to that.
Yes, well, what about the side price? What about the people of sale?
We have to use mics, please, because we are live broadcasting. So I'll go to the next question. Wayne?
The linking to meat eating quality, that's the consequence to farmers. Magnifies that little blooming thing that I can't see up into the big end of the town. It is that link that is the business risk to many people. It is a business risk to our beef industry. It is a business risk to the sheep industry. That is the problem. It is not to do with the J-BAS. J-BAS is fine. Just don't have it applied to LPA. We are going to have the same organisation discussing risk in the public sphere that is discussing sheep meat eating quality. Ask any PR person, you make sure you keep your good news wildly separated from the bad news. Disease is bad news. You don't have to go into the sophistication of how often or what. It's bad news. Once you mention any disease by the same organisation who's looking after our meat eating quality, you put a big risk on the millions and the investment in the meat eating quality, all the electrical stimulation, that part of our industry. I think that is a fatal mistake that no industry leader should have put their name to.
I'm assuming you're talking about the biosecurity module being included in LPA. Yeah. It's literally about market access, and it's kept as a separate module to the animal health and welfare one and to the others. The documents that were put up earlier about the originally there were a lot of people, farmers, wanting us to put those diseases, J-BAS and that on the NVD, so they only had one document to deal with. We resisted that for exactly the reasons you're talking about.
But you've done it. If you can't get LPA authority because of...
Wayne, you have to use the mics, please.
Yeah, I understand exactly what you're saying.
Exactly
One there,
what you just said we didn't want to do for the NVD. You have done it. You've put it together. So we can't claim that we've provided best practice on meat eating quality while ever that's compulsory to do a J-BAS and a biosecurity plan. That is your big mistake, and it will put your whole thing back. People will not respect disease manufacturing when you've linked it so that meat eating quality part of the research, which has really been a good news story for the industry, is suddenly linked to disease. It is PR people will tell you, and have told me many of times, you have to be very careful in making comparisons, metaphors and all that sort of thing, that you don't mention something like virus or everything else. You've just done that.
Okay.
Thank you, Wayne. Now we've got another Wayne.
Thank you, Mr. Chairman. My counterpart Wayne has alluded to it, but I would like to make the comment, and I think everyone in this room will agree with me. I have never seen such a stuff up in rolling out something in an industry other than OJD, which ended up an absolute nightmare. It's fine to say, and what I'm coming to, I want to know who's going to put the hand up and take responsibility in our industry for the lack of rollout and the clarity around what's being involved. Because I can tell you now in my area, and I went to one of the workshops, no one was given the job of rolling this out. In our area, LLS took it upon themselves to put on some workshops. They had no information, basically, and they're vets. We had LBN there that knew bugger all as well. When you put a workshop on, you get 90 people in a room that want to ask a lot of questions, and they get very rare, many, if any, answers to those questions about something that's affecting their livelihood in 3 months' time, you've got serious problems. Excuse me. I'm firmly of the belief, and people have said it, if that article hadn't come out in the Land that said you couldn't sell any cattle in 3 months' time if you haven't got a biosecurity plan in and a score of 6, we wouldn't have known anything about this still. So I'm looking you in the eye, Tony.
When I did the...
You're our representative on Cattle Council. We've got a representative from AHA. The message I get, AHA have no money to roll anything out. Cattle Council are there as our industry reps. And I think, I don't know, I think there's something coming probably, but I've never seen people walk around and say they can just stick it up their jacket, I'm not even doing any of it. So you've blown LPA accreditation out the water, you've got confusion with J-BAS, and you've got nightmares with biosecurity plans. So I'm not sure what the answer is, but I think somebody's got in the industry has got to put their hand up and say, sorry, we stuffed it up, we might have to start again.
And having 2 different times rolling out the concept around biosecurity plan is a nightmare and was a mistake. Dealing with several parts of industry and trying to get the same thing happening at the same time, impossible. The rollout of LPA will be done by the Industry Systems Company. The rollout around this was supposedly, AHA delivers on industry policy. So the question will be, will there be a difference? And will we be able to measure why we haven't had things come out very well? When I did an interview with the land last week after it, I asked the journo for the land, John, I think it's Ellicott, when did the land start running articles on this? And there were 2 articles run in July 2016, one in December 2016. So why people have picked it up and wanted to panic about it in the last month, I don't know. And how do we get people to actually... Rolling things out in the land or Queensland country life is just not good enough.
Thank you. We've got a question down here.
Hi, Julie Moore, representing the Dairy Committee. Just a question for you in relation to dairy farmers. Quite a few dairy farmers run beef cattle as well. We do on our farm, albeit a small operation of beef cattle, only 20 head. And of those 20 head, there's possibly only 5 that are over 4 years of age that could be tested for BJD. The heifers, the crossbreds are run through our dairy operation with all our dairy heifers, which we've tested. So we come in at a score 7 on the BAS, for the Jones, for the dairy. When we then do the beef operation, they're not tested. But one of the drivers for testing on the dairy side of it is to remove your calves within 12 hours from suckling from their mother. How is, it's impossible for a beef cow to remove the calf. It's with its mother for 9 months, 10 months of the year. Where does this all marry up? Because, there's just a chance of a beef calf, suckling off its mother with some dirt on the teat and contracting yonis. Part of we have to tick the box on the dairy side to say that we remove the calf. So there's no marry up between the two systems from what I can see for the accreditation, for 7 on the dairy side to 7 on the beef side.
Thanks, Julie.
Yeah, so the 2 scores are roughly equivalent, but they're different management systems. And certainly, as I mentioned earlier, Dairy Australia's responsible for the dairy score. So, the elements of that, I guess, have been worked out with the dairy industry previously. As far as a small number of beef cattle that are on the same property, whether you choose to sort of use your dairy score, which obviously you've gone to some trouble to get to a 7, I imagine. So, maintaining reasonable biosecurity with that small herd is possibly all that you need to do. The testing, you mentioned the age issue, whether you would, do them, the small number of animals to maintain a 7 with them, or how you manage that, I guess, that would be handled, I guess, by your veterinarian who you would be working with.
Yeah.
Yep.
Thank you, Chris. And then one last question up the back.
Thanks, Chairman. I'm just wondering, a question to Animal Health Australia, how does this affect the sheep industry as well? Because it was fine, it was all cattle industry till we got to the bottom and you said there's going to be a module on LPA, which we were aware of it was coming. How does this now affect anyone who has a Yoni score, who has gone through a market assurance program with the sheep industry? Where are you going to slot that in?
So the sheep industry has an OJD management plan and sheep map. So the question is...
The question is basically, so what we need to do when we do our on-farm biosecurity plan to look for a score, anyone who already has an OJD MAP for the sheep industry, that just remains the same, does it? Whatever we fill out on the on-farm biosecurity plan won't affect that in any way.
So if you don't have any cattle on the property, you would just fill out the general
That's right, but
biosecurity plan.
Most places are mixed farmers. I think most of the people sitting around the room who are in the central regions from the north, the ranges from the north of the state to the south of the state run both sheep and cattle. And I think there's going to be an effect from one industry to the other.
Yeah, so, I mean, obviously we've talked about the issues of the sheep strain and things there before. Certainly for areas at the OJD and endemic areas, you know, the main mitigation for keeping clinical cases away, at bay on the property is vaccination. So obviously vaccination of the sheep's most important thing to be doing there. And the vaccine, although it's not 100%, it's certainly pretty effective. Will, in most cases, minimise clinical cases.
Do you understand where I'm coming from, though, Tony? What I'm asking? Can you have a crack at, please, to clarify?
I don't think I can't answer that here. Right. I don't have particularly enough information or knowledge about the sheep industry. What I will say to you is that I sat through this conference here in the 90s and saw what happened to the sheep industry. And when I went to the meeting that AHA first had in February 2015 at Sydney Airport, which this association in both dairy and cattle was represented at, my intention was to make sure we avoided what happened to the sheep industry. I will say to you now, we've actually caught the sheep industry here, people running beef on top of that sheep industry, we've caught them in the crossfire and we need to deal with that. And it's not going to be dealt just by Cattle Council, it's going to be dealt by wool, sheep and cattle together. And I think we need to go to AHA together and say, it hasn't been done right, we've got to fix it.
Thanks, Tony.
Right, one last question up there and then Ian McCall down here.
Mr Chairman, Wendy Morris, Dubbo area. I'm really pleased to hear you say that last comment. A mixed farmer is really struggling with this, and whether the Sheep Meat Council was involved is a question that came up earlier. I'm really concerned about filling out paperwork. It says here I've got to check everybody that has Q fever, tetanus, leptospirosis vaccinations if they're dealing with cattle on the farm. I'm from an area where there's just a history where if it's east of the Newell, you've got to be very careful buying sheep onto your property because of yonis, but you know, people try and fill it out correctly and go off the best they can do that it's a low prevalence area. Because not everyone wants to be tested. It's the same with the cattle. When you said we just have to do our bit of paperwork and file it, from my understanding, if I want to get an NVD book again, I have to produce that and also apparently I've got to fill out some more on-computer programs.
Just firstly, before you go on, you won't have to produce that, but if you undergo an audit for LPPA, you will have to show that you've got it.
Yeah, and that was the other one I was going to say. We have an LPA audit that we'll have to do. So there will be times that may have to come out. I'm just concerned who is the integrated systems company that you mentioned earlier, and also too, as the gentleman said earlier, if it really wasn't for that land article, even though many of us knew this was in the pipeline, we never knew how serious it was because the mixed farming side of it, that history of yonis and the fact that people run cattle, you know, so it's a big issue. So I'm pleased you're addressing it, but I really wish we had more time.
Yeah. The integrated systems company is bringing a lot of the systems that we've had in different sectors together. NLIS, where will I go with this, the rest of them? LPA, Ausmeat, bring it all together so it's managed under one and to try and coordinate it all so you can all get it together. And leading up to now, it's been very difficult. Whenever you wanted to make a change in something, you've had to do it in several different sectors. So bring it all together will hopefully enable change and development to be progressed sensibly and better. The point about the biosecurity plan is that you can do it and chuck it in the drawer if you want to and do blooming nothing, or you can actually treat it as a good exercise for your business to actually learn and yourself and take the opportunity to get someone in and do something. If you just do your books for tax and do nothing else, good on you. If you do your books for tax, fine, you've got to do that. But you can also do your books to analyse your business and to see where your strengths are. I want you to look at the biosecurity plan as exactly that. And if you're looking at diseases and impact on humans, Q fever and lepto, I mean, the reason I do lepto, my herd for lepto, is I don't want lepto. So, you know, the biosecurity plan can be of benefit to you, or you can just chuck it in the drawer. It's your choice.
Ian, last question.
Chairman, thank you. I rise to speak with some hesitation, having had a considerable level of experience in the sheep industry with OJD and very aware of the level of angst it can cause, has caused the lack of information that's out there. People's real concern that they just basically don't know how it's going to impact them. I mean, to me, that's the bottom line, and it's something as an industry I think we've faced all the way through. Comment was made, or a question was asked before, whether the sheep meat industry, Sheep Meat Council was involved in this. To the best of my knowledge, they weren't. They certainly weren't involved in this. And I would have to say, given our experience in the sheep meat industry with the different numbering systems, which many of you would be well aware of and no doubt had the history with, it created a major issue and a concern and a problem of its own of people trying to get to a 6, to a 7, to a 3, to a 4 or whatever. And certainly I understand why we're putting up the 6s, 7s and 8s, but it does create a problem of its own. With what's happening with, it's unfortunate with LPA that the timing is happening. I mean, unfortunately, I guess you get to the industry level and you try and bring in some of the changes at the same time, so you're not bringing in as many changes. I think in this case, perhaps that hasn't worked quite as well as it should. As Chris said, the real concern, I think, is there's a lot of people who've had experience and have sheep flocks and have had experience in the Yonis area and wondering what is going to be the resultant impact on their business of the crossover when they're running cattle. So they're going to have to run a JD scheme with cattle and potentially a JD scheme with sheep, which is extremely difficult, and we need to put it together as an industry. Chairman, I think, look, it's an extremely complex issue. How do we make progress from here? And I mean, there's not much point. We can throw the brickbats all we like, but I would like to offer that we put together a task force from the association, and I'm happy to bring some wording perhaps to you either lunchtime or at the break, and we can bring it back later so that we can put together cross-species information, we can put together the expertise that Tony's actually talking about, we can actually get producers in there, go work through these problems and come up with an outcome that works for the whole industry. Thanks, Chairman.
Thank you, Ian, and I think that's important. I think the time for blame is probably over. We have to learn from the mistakes and move forward and try and get a resolution. So I think that would be a very good thing.
Just a comment. I'd fully support that, Ian. Secondly, there were submissions made from both sheep and wool to this review process for the beef industry.